is pelvic pain related to posture? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. I did a video on what causes pelvic pain. One of the things that I mentioned had to do with actually every single thing that I mentioned in that video. Your posture plays a role there. So the relationship between your posture and your pelvic pain, I'm just gonna kind of briefly outline the correlation. Your posture or poor posture has to do with breathing, as an example. Your breathing plays a role, I should say. Every single person in my practice has a breathing dysfunction. We're all breathing, but not correctly. Breathing is what stabilizes your whole body, including the connection between your spine to the pelvis. If that connection is not stable, you will have pelvic instability, and as a result of instability, just like the video I mentioned, the causes of pelvic pain, there are different structures that will be compromised as a result of that. Your poor posture essentially means it's instability of the pelvis. So the pelvis where the spine is connected is unstable, so it can be in a flexion extension, it can be in rotation, it can be the other rotation, it can be side bending, a different presentation, or a combination of. Then how your legs are connected to your pelvis. Well, we know ideally and more than likely it was connected correctly, but your lifestyle, habits, injuries, all of those play a role as to how stable / unstable that connection is. So if they're dysfunctional and unstable, they'll cause instability in the pelvis. So you can compress soft tissue. Soft tissue can be ligaments, it can be muscles, it can be tendons, it can be nerves, arteries, it can be everything but your bones that can be compromised as a result of the dysfunctional joint. So any joint that is in the pelvis, so we're talking about pubic joint, pubic symphysis in the front, and the two SI joints within the pelvis. Then we're talking about connection of the spine to the pelvis, connection of your lower extremities to the pelvis. All of those can cause pain or dysfunction in them, or related to those areas can cause pain in the pelvis and contribute to it. So these are all related to posture, and the relationship between posture and pelvic floor dysfunction is, you can't separate the two. And yet when it comes to the world of pelvic floor dysfunction therapy, there is some attention given to posture, some attention more so than posture is to breath, but majority of the work is done internally, which to me only makes sense after we have stabilized the pelvis. So I hope that this makes sense to you. If you have any questions, use one of the methods of contact in the description box. And until next time, take care.